And then if you could take it round for her afterwards, that'd be great.
Thank you. Hi.
Hi, Pete.
As Hull born and bred, really nice to see Smith and Nephew represented, and also J&J, the My Group, another Hull-based company. Random fact, but I reached out to them to say, I used to work for Yorkshire Wildlife Trust. What about if you made habitat boxes for those? And sure enough, they've done that. So it's brilliant. I love to see that circular economy. In terms of the supply chain stuff, and you might have talked about this, Chris, but the supply chains are really complex, and we're starting to see companies that can help bring those networks together through technological digital means, and I think that's absolutely essential. You know, we can't map these things out on a spreadsheet anymore. What kind of software, digital platforms are you using as big companies, and is there scope to kind of, you know, learn from you about how are you mapping these very complicated supply chains?
Okay. Perhaps Chris Scott, do you want to?
Yeah, so can't talk to the specifics necessarily, just more out of not knowing them, right? But I think it's, like I mentioned before, partnerships with the likes of Schneider Electric, you know, kind of other large organisations to help us on the journey. Mentioned before, we've been doing this for a long time, right? But it doesn't mean we are the experts alone. We have to work with other organisations and look for further improvements. In the UK specifically, we have just kind of upgraded some of our software systems, which I guess the key thing is it doesn't allow us to make improvements today. The key focus for us is how do we maintain business continuity. Our customers can't work if we're not delivering it outright. So it's also making sure that we maintain business continuity whilst making those sustainable changes in the background, which is quite hard, right? But I can't answer in terms of specific organisations per se, just out of not knowledge in that part.
And James?
Probably very similar. So as I said, Jackie would be the expert in terms of picking up on the systems that are used. I think the key thing for us, I think, is we're obviously a global company, but it's investing in the local economy. So for mentioning Hull, so there's a big site being built there to look at like innovation and things and bring it close to home.
I can probably add a bit of this. That's sort of our bread and butter. As part of the consultancy, we talk to lots of organisations about their supply chain and how effective it needs to be. I guess in terms of systems, there's a whole suite of systems, but just to take it in sort of like 3 layers, we work with people who just want to make a change to their supply chain they have today, and to make it more resilient or make it more cost effective. Make it more carbon effective, and quite often we will pull together solutions that will give them an answer or an option on each of those things. So sometimes, like with the HVO discussion that we had earlier on from the transport team, that can be slightly more expensive, but it's the decision that people want to make, and we do have organisations that do that. We build supply chains for organisations and use some quite detailed planning tools, but at the top of that, in terms of service delivery, we run a service called Lead Logistics Provider, which gives a single point of visibility for a customer who has a supply chain they can see through aggregating information from all sorts of different places, a single view of service and impact and cost.
Great, thank you. So if we take our second question there, and then we've got one question there, and then we'll break for lunch.
I think it's a question for you, Fiona,
right,
rather than the others. I mean, it's been wonderful to see the part that Johnson & Johnson unit part are playing, but I think language is important here. I would argue that what's happening here is really outputs rather than outcomes. And I think the central issue that I'm struggling with here is that even if everything was wonderfully successful in hospital, in supply chains and all the other elements, we've still got the problem that we've got inequalities. And those inequalities, what's happening is that the hospital may now produce in the most efficient manner and carbon neutral way a solution to an individual patient's problem. But we're then throwing them back in to the cesspit that made them ill in the first place. So they'll then come back in again. Now, to what extent in terms of measurement are those issues being taken in terms of helping develop health policy from your perspective?
Good question, and I guess it reminds me of Michael Marmot's point about the causes of the causes. Absolutely. I mean, I think what's very interesting is that when you look at the procurement framework, the Evergreen framework, inequalities and the approach to that are built in. We absolutely need to be mindful of that, and I think all of these approaches we have to balance across a number of different dimensions. You know, vulnerable people are going to be impacted more, sadly, by the impact of climate change, as we've heard. And we need to really keep on our toes to make sure that we design services. What I would say finally, though, is I think that some, for example, the use of digital, if people are able to use it, can really support them in a way that perhaps wasn't true before. So I think we need to look at that innovation challenge, really think about who we're serving, and make it really person-centric to precisely deal with what you're saying, and then check that it's working. So thank you for that question. Yes, our final question. Thanks for your patience.
Thanks. So I'm Rebecca Waters. I'm the ICS Green Plan lead for North East London. So it's a question to you, Fiona, about the coalition, really.
Yes.
So we're lucky because we prioritised any funding we had for net zero to pay for session time. So we have 4 clinical leads for net zero in our system. And I worry about them because whilst they have a session time, they're doing this on top of their clinical job. And they spend their evenings and weekends doing it on top of their clinical job, and they have other commitments. So I'm wondering how the coalition can help with support, pastoral care and climate anxiety amongst those that are taking it on top of their day jobs. And we, as Kim said, we have more people working in sustainability, but those teams are still really small. And whether you're doing any work on that.
Well, I think as a coalition, what we focus on often is supporting people through using easy tools to try to make their jobs easier when they're looking at measurement. You're going to be hearing this afternoon from Rachel from the Centre for Sustainable Healthcare, and together, I think, as organisations, we've worked with a lot of clinicians, supporting them through their frustrations of their journey for change, and Rachel will talk much more about what they're doing to support people. I think the mental health aspects and, you know, the innovations like climate cafes and things to really help people talk about their anxiety, how it's facing them, are really important. And I think, you know, the more we can share approaches, the more we can learn from what colleagues in the industry are doing as well with their own people, is important too. So we're always open to working with people and having a conversation. And I'm sure Rachel will say more about supporting clinicians this afternoon. Thanks for your question.
Thank you. And just one more point. I checked out the catering for lunch before this break, and I'm a bit disappointed to see that there's red meat on the catering on a net zero event. So could we think about making sure that all NHS events have plant-based catering and not just net zero ones?
That's a point well made, and I'm delighted to say I personally didn't organise the menu, and I'm sure the people who did are making a very careful note of your point. Thank you for that. Well, with that note on lunch and what we may or may not get, and I'm sure that all of you will not eat the meat option, having had that warning. Really enjoy your lunch. We've got a fascinating series of speakers this afternoon, lots more opportunities to ask questions and lots more opportunity to ask questions of our speakers too. So thank you very much for all your attention, and for those of you who are speakers, thank you also. And we look forward to seeing you back here at 2:10. So enjoy your lunch and see you soon.